We reached out to the government, HSA, Minister Seymour, Cabinet Secretary Rose, just to understand if there was anywhere that Health City could actually help. Luckily at that time, they actually said, guess what? We actually do need help. We're having issues with our regular distribution channels. A lot of stuff from places like the US no longer could come, obviously. So anything you can do, definitely please go ahead and do it.
Well, it took some time for us to source this. Initially, we were having trouble through the US, where we normally get our supplies. So we had to find a partner to work with. HCCI reached out to us and says, we think we can solve the problem. Everything started working beautifully together. Just proves that public and private partnership is key to getting most things done, especially during a crisis.
Over the past several years, I've had the privilege of working with HSA and Health City Cayman Islands as they have worked in collaboration and cooperation to assist other Caribbean islands during national disasters and our responses. Now we have come to a point where Cayman is facing this global crisis, and once again we have seen that fantastic working relationship between the Health Services Authority and HCCI working for the benefit of the Cayman Islands people and for our medical professionals.
So it was 3 weeks of day and night working around the clock to actually get these PPE kits from China. Guess what happened? The Chinese government put out a decree that every shipment of medical equipment had to be inspected by the Chinese government. It only gave us 5 days. And due to the situation we're in now, if you miss that chartered plane, that means all the goods have to stay there and you lose your money for the chartered plane. So we had 5 days in which to get the inspection. And knowing that it could take 20 days, they did a great job, used their diplomatic ties. We got the 2 thumbs up to say that the shipment was good. So we were able to lift those wheels up from Shanghai and get it here to the Cayman Islands.
We're in a very good position now. We have received a large amount of PPEs. Part of it will go to Health City Cayman Island, and the rest will be used at the Health Service Authority and any other facility that is needed here in the Cayman Islands.
All of this would not have been possible without some key people. Lizette Yearwood, the CEO of HSA, but also Mrs. Dawn Cummings. She's the CFO, but she seems that she has to be so much more. She was really on the ground with her logistics from an HSA perspective, and much greater than this shipment, she's coordinating everything across the board. And we at Health City were just happy to be able to come in at this point in time to help the country when it was needed, and we're always here for you. We've always been here, we'll be here for many years to come, and whatever Health City can do, we'll definitely do in order to make the Cayman Islands community the best country in the Caribbean.